Hello, everyone. Professor Baig here. Today we're going to talk about the urinary system. The lecture is divided into two PowerPoints. First, we're going to go briefly over the overview of the urinary system. And the second lecture, we're going to talk about the specific urinary system disorders. And over here in this one, we're going to review briefly the anatomy and physiology of the urinary system and then discuss how alterations in urinary function can affect overall health. So first of all, the urinary system is essential for maintaining homeostasis. Every minute, the kidneys filter blood, remove waste products, regulate fluid and electrolyte balance, help maintain blood pressure, and support red blood cell production. Because these functions are interconnected with many other body systems, kidney dysfunction can have a lot of widespread consequences throughout your body. So as we move through this lesson, think about how changes in your kidney function can affect cardiovascular function, fluid balance, blood chemistry, and overall health. Here are the learning objectives for this lecture. This is an outline of what we're going to cover in this lecture. So before we discuss urinary disorders, it's really important to understand the normal structures and functions of the urinary system. If you don't understand the normal function of something, you're not going to recognize abnormalities. And that's extremely important, especially if you are studying to be a nurse. So the urinary system consists of four main components: two kidneys, two ureters, the urinary bladder, and the urethra. Together these work to produce, transport, store, and eliminate urine. The kidneys are the primary organs of the urinary system and perform several critical functions that help maintain homeostasis. One of their most important roles is filtering the blood to remove metabolic waste products such as urea and creatinine, which are produced during normal cellular metabolism. In addition to the waste removal, the kidneys regulate the body's fluid balance, and they do this by adjusting the amount of water excreted in the urine. They also carefully regulate electrolyte levels, including sodium, potassium, calcium, and chloride, which help maintain normal cellular function. Another essential function of the kidneys is maintaining acid-base balances. So the kidneys help keep the blood pH within a narrow range we talked about in our acid-base lecture by excreting the hydrogen ions, right? And they conserve bicarbonate as needed. So the kidneys also play an important role in blood pressure regulation. They do this through the renin-angiotensin-aldosterone system, which we call as the RAS system. So the system helps control blood volume and vascular resistance when blood pressure decreases. So in addition, the kidneys also produce erythropoietin, a hormone that stimulates red blood cell production in the bone marrow. This is why patients with chronic kidney disease often develop anemia. Even patients who are on dialysis, they are given, erythropoietin because their kidneys do not function well enough to produce it. So the kidneys are also responsible for activating vitamin D, which is necessary for calcium absorption and bone health. Finally, the kidneys help eliminate a lot of medications, toxins, and foreign substances from the body. To appreciate the importance of these functions, consider that the kidneys receive approximately 20 to 25% of the heart's total cardiac output at any given time. So basically, that's about a quarter of the cardiac output is being sent to the kidneys, which shows how important the kidney is, when it comes to the functioning of the body. This large blood supply allows it to continuously monitor and filter the blood, making it an essential organ for maintaining internal balance and overall health. So the nephron, let's talk about the nephron. The nephron is the functional unit of the kidney, and each kidney contains approximately 1 million nephrons, and every one of them is important. The nephron consists of two major parts: the renal corpuscle, which includes the glomerulus and the Bowman's capsule, and this serves as the primary site for filtration. Blood enters the glomerulus and under pressure, allowing water and small solutes to be filtered into the Bowman capsule. Now, the tubular system includes the proximal convoluted tubule, loop of Henle, distal convoluted tubule, and collecting duct. These structures modify the filtrate through reabsorption and secretion. So the proximal convoluted tubule, it reabsorbs most of the filtered water, right? Because the body doesn't want to just like get rid of all the water in the body, right? So it's going to filter the water, glucose, sodium, and nutrients. The loop of Henle creates concentration gradients that allow the kidneys to concentrate the urine. The distal tubule and the collecting duct provide fine-tuning of that water and electrolyte balance under hormonal control. So now when nephrons are damaged, filtration decreases and waste begin to accumulate in the bloodstream. And that is not a good thing. Now, let's talk about urine formation. I created this cheat sheet so you can kind of remember how, use it to study. Urine formation occurs through three major processes: filtration, reabsorption, and secretion. We kind of briefly mentioned this in the previous slide. Now, during I could never pronounce this, glomerular filtration, water and small molecules pass through the filtration membrane into the Bowman's capsule. Now, the blood cells and the large proteins normally remain within the bloodstream. That's why we don't see it normally in the urine, right? The urine does not contain the proteins on the blood. Now, during tubular reabsorption, the kidneys reclaim substances that the body still needs, including water, sodium, glucose, amino acids, and bicarb. So these are the things that it will reabsorb because the body needs it, right? Approximately 99% of the filtered water is reabsorbed because your body needs water. Remember, we're 60% water. During tubular secretion, additional waste such as hydrogen ions, potassium, medications, and toxins are actively transported into the tubular fluid. Now these get excreted. So the final product of these processes is urine, which contains excess water and waste products that the body no longer needs. Now the kidneys work really close with several hormones to regulate fluid balance and blood pressure. Now the antidiuretic hormone is one of those. This is released by the posterior pituitary gland. So ADH increases water absorption in the collecting ducts, which concentrates urine and decreases urine output. So when your blood pressure is low, if somebody's volume is low in the body and their blood pressure is low, the antidiuretic hormone, think of it like this, anti-diarrhea. So it's not going to get rid of water, right? It's going to hold it. So when it's released by the pituitary gland, the water is reabsorbed in the collecting ducts. And this basically means when more water is reabsorbed, the urine is going to be concentrated, right? And it also will decrease your urine output because now the body is trying to hold the volume in because the blood pressure is low. Aldosterone is produced by the adrenal cortex. This promotes sodium reabsorption and potassium excretion. Now remember, water follows sodium, right? So if it's reabsorbing the sodium, then water is going to follow it. So this is how aldosterone helps to increase blood volume and blood pressure in the body by keeping the volume in the body. The atrial natriuretic peptide, ANP, has the opposite effect. It is released when the blood volume increases. So now when your blood volume is increased, what do you need to do? We need to get rid of some of that volume, right? And so when the blood volume is increased and it promotes sodium and water excretion, helping reduce blood volume and blood pressure. So basically it excretes and helps get rid of the sodium and water follows it. The renin-angiotensin-aldosterone system, the RAS system. This is activated, when blood pressure or kidney perfusion is decreased. It's also another system that helps to keep the blood volume in the body, at normal levels. This system, it causes vasoconstriction. Like over here, if you look at this diagram right here, the RAS system, it basically, your kidneys release renin, and when renin is released, it it converts to angiotensin, then angiotensin 1, then 2, and this happens in the lungs. And then this causes vasoconstriction, right? And that helps increase the blood pressure. And then when angiotensin 2 also activates aldosterone, which holds on to the sodium, to the water and sodium, but loses potassium. And so in this case, your sodium is retained and your blood pressure goes high because water follows sodium. Normal urine provides valuable information about kidney function and hydration status. You can tell a lot from just even looking at the urine. Adults typically produce 1,000 to 2,000 milliliters of urine per day, 1 to 2 liters. The urine is normally pale yellow, or it's called amber because of the pigment urochrome. Now, specific gravity, it refers to the urine concentration, how concentrated the urine is. So if it's high, that means the urine is very concentrated. If it's low, that means the urine is more dilute and it's not as concentrated. So normal range is 1.005 to 1.030. A higher one, as I mentioned, indicates dehydration, for example, where the urine is really concentrated, while a lower specific gravity may suggest renal dysfunction or excess fluid. If you have too much, if it's very low, then you have too much fluid in the body. Normal urine pH ranges from 4.5 to 8, and it's really important that the body maintains that acidity in the urine because it also helps prevent urinary tract infections and things like that. So diet, medications, infections, and metabolic conditions also can, influence the urine pH. Urine should normally appear clear. Cloudiness, blood, protein, bacteria, or abnormal odors can indicate infection or disease. Like in the past, a long time ago, thank goodness we're not in that time as nurses, but sometimes when the urine smells sweet, the nurses would have to taste the urine to see if there's sugar in the urine. So to see if patients had glucosuria. That's how they detected DKA or HHS. And which, these days, thank goodness we don't have to do that. Now let's talk about alterations. We talked about what normal urine function is, how the kidneys make urine, how the body processes, the urine, how it excretes it, how it retains it. And so now let's talk about alterations. Now, alterations in in the urinary system include incontinence and retention. So as we move into these alterations, it's really important to recognize that problems may involve either the storage of the urine or the elimination of the urine. So the two common alterations are incontinence and retention. Although these conditions seem opposite, but they can significantly affect the quality of life and indicate underlying pathology. Now, impaired urination occurs when urine flow is reduced or the urine remains stagnant in the urinary tract. Urinary stasis is important because it increases the risk of infection, stone formation, bladder dysfunction. You don't want to retain your urine. You want to get rid of it, right? So impaired renal function occurs when kidneys lose their ability to adequately filter the blood. Now, as the filtration declines, waste products will accumulate. Electrolyte imbalances are going to develop because now instead of excreting the potassium, it's going to hold the potassium, right? It might excrete the sodium. So there are a lot of things that can go wrong with electrolytes as well. And fluid overload could occur because if we're not peeing, then the urine is being retained. Now, depending on the severity, renal dysfunction can progress from mild insufficiency to complete kidney failure. And we're going to talk a lot more about this in your next PowerPoint on urinary system disorders. Now, incontinence is basically the involuntary loss of urine. It can occur because of weakened pelvic floor muscles, neurological disorders, urinary tract infections, or bladder dysfunction. Now, stress incontinence occurs when increased abdominal pressure causes leakage during coughing, laughing, or exercise, right? Urge incontinence results from overactivity of the detrusor muscle and in the bladder, and it's associated with sudden need to urinate, like you can't hold it in, it just goes, right? Overflow incontinence occurs when the bladder becomes overly full, and then it starts to leak. It cannot empty properly. Now, retention is the inability, on the opposite side, that was incontinence, where it just comes out. Retention is the inability to completely empty the bladder. Common causes include enlarged prostate, urethral strictures, tumors, neurological disorders, medications such as anticholinergics and opioids can also cause urinary retention. Now, untreated retention can lead to urinary tract infections, hydronephrosis, and permanent kidney damage because the urine backs up into the urinary system. So as the filtration is going to continue, and so it basically backs up that flow. Now, this image over here summarizes the different types of urinary incontinence. Please review it. Notice that each type has a different underlying cause. Understanding the cause is important because treatment varies significantly depending on the type of incontinence. For example, stress incontinence may improve with pelvic floor exercises, but urge incontinence often requires bladder training or medication, right? So it's extremely important to understand the difference between each type of incontinence. This image over here illustrates urinary retention and its consequences. When urine cannot leave the bladder normally, pressure increases throughout the urinary tract, and over time, the bladder will stretch, urine will back up into the ureters and kidneys, and hydronephrosis could develop. Now, if the obstruction is not relieved, kidney damage can become permanent. Now let's talk about diagnostic testing. We talked about normal urine function, how the body produces urine, how the kidney filters it. We talked about the two major alterations, the incontinence and the retention. So now let's talk briefly about the diagnostics used in urine, detecting these disorders. Diagnostic testing helps evaluate the kidney function, identify urinary tract disorders, and guide treatment decisions. Common tests include urine analysis, urine culture and sensitivity testing, blood tests, and imaging studies. Now, these tests provide important information about the filtration. It provides information about infections, structural abnormalities, and overall kidney health. So this is a cheat sheet I created for our urine analysis. This is one of the most frequently performed diagnostic tests. It's the gold standard. If any UTI is suspected, this is the first thing that's done. It evaluates physical characteristics, chemical composition, and microscopic findings. Abnormal findings like proteinuria, hematuria, pyuria, positive nitrates, or leukocyte estrates can help identify kidney disease, infection, inflammation, or glomerular damage. Urine analysis is often the first clue that a urinary disorder is present. The next thing is the urine culture and sensitivity test. So this identifies the organism responsible for the infection. So the urine analysis just basically detects an abnormality. The culture and sensitivity culture identifies the organism that is responsible for the urinary tract infection, while the sensitivity test determines which antibiotic will be effective because it's basically testing, which antibiotic that organism is going to be sensitive to. A positive culture typically shows significant bacterial growth, and the standard number is more than 100,000 colony forming units per milliliter. So this test is especially important in recurrent infections, resistant infections, infections that are UTIs that are resistant to antibiotics. It's important to know instead of patients receiving broad spectrum antibiotics, which just kill any kind of bacteria, good and bad, it's important to do a CNS so we know exactly which antibiotic works. And this is something the provider does. Now, several blood tests also provide valuable information about kidney function. Blood urea nitrogen, or BUN. It measures the nitrogenous waste in the blood. So if there's too much nitrogenous waste in the blood, kidneys are not doing their job, right? They're not removing that waste. So that's what we detect. So elevated levels indicate reduced filtration, right? And creatinine is more specific indicator of kidney function. So BUN, is an indication of waste, nitrogenous waste. Creatinine is an indicator of kidney function because it is produced at a relatively constant rate and filtered by the kidneys. Now, estimated glomerular filtration rate, as we call it, the eGFR, GFR, is considered the best overall indicator of kidney function. And it's used to stage chronic kidney disease. And we're going to talk more about that when we talk about chronic kidney disease in our next lecture. Electrolyte abnormalities, especially hyperkalemia, too much potassium, are common in kidney disease and become life-threatening. So now patients who are on dialysis, usually right before the dialysis, they're about to get dialyzed, their potassium levels are really high. The electrolytes are, also other electrolytes are also imbalanced. So this is something, this happens because remember, normally the kidney would excrete the urine, in the potassium in the urine, right? But because it's not filtering, it's retaining the potassium. It's keeping it in the body. And so it's circulating in the blood at high levels. So that is something that the GFR, helps us to detect. Now, imaging studies of the urinary system, we talked about the urine test, urinalysis, and culture and sensitivity. We talked about blood tests, especially the BUN, creatinine, eGFR. All of those are very important. Now, other imaging studies help evaluate kidney structure and identify abnormalities. So because with the imaging, they can detect the structure of the kidney, see if there's actually some abnormality physically. Ultrasound is commonly used to evaluate the size, kidney size, hydronephrosis, cysts, and tumors. CT scans provide detailed images and are considered the gold standard for diagnosing kidney stones. So when a patient has they suspect kidney stones, CT scan is the gold standard. Cystoscopy allows direct visualization of the bladder and the urethra, while basically it's a little camera they put inside and they, kind of visualize all of the bladder and the urethra, check the flow. So cystoscopy, okay, that was that. Sorry. And with renal biopsy, the renal biopsy is used when we need tissue samples to diagnose any like renal disorders like renal carcinoma. So a little tissue sample is taken and sent for a biopsy. So common treatments. Common treatments usually to help when the kidney is not doing its job, right? Not filtering the blood, not excreting urine. If the kidney has failed, then common treatments include dialysis and there are medications also that help with this. So when kidney function declines significantly, the treatment is going to focus on supporting filtration. The blood needs to be filtered and correcting the electrolyte imbalances because as we all know after the fluid and electrolyte lecture, electrolyte imbalances can cause a lot of damage, a lot of problems, serious problems. And dialysis will also help to prevent complications. Two major treatment categories, dialysis and certain medications. These help maintain the homeostasis, which is very important. And when the kidneys are unable to perform the normal function, these are what are used. So let's talk about dialysis. Dialysis basically removes the waste products, excess fluids, electrolyte imbalances, when the kidney can no longer adequately perform these functions. Hemodialysis circulates blood through a machine called a dialyzer, which acts as an artificial kidney, basically. Right? So peritoneal dialysis uses the patient's own peritoneal membrane as the dialysis membrane. So although dialysis can sustain life, it does not fully replace normal kidney function and requires ongoing management. We can't just dialyze once and then we're done, they constantly have to get dialysis 3 times a week. Now, some medications are that we use because remember the kidneys help excrete fluid. So if the kidneys aren't excreting the fluid, then your body is retaining the fluid. And if there's too much fluid in your body, it can increase your blood pressure. It can put a lot of pressure on your heart because the heart has to pump that volume, right? And so it can end up causing heart failure. A lot of different problems can happen from it. So diuretics basically, increase the excretion of sodium and water and are commonly used to treat hypertension, edema, heart failure, and certain kidney disorders. Loop diuretics, such as furosemide, Lasix, are the most potent and act in the loop of Henle. Thiazide diuretics are often used for hypertension. Potassium-sparing diuretics, like the name says it, potassium-sparing, help prevent potassium loss, but increase the risk of hyperkalemia, right? Because now you're retaining the potassium, now the opposite risk, opposite problem is a risk. Because diuretics alter fluid and electrolyte balance, patients always require careful monitoring. Please review this cheat sheet. It gives you a brief idea of what each diuretic is and what, the signs and symptoms are, adverse effects, things like that. Okay, and in summary, basically the urinary system is essential for maintaining homeostasis through waste removal, fluid regulation, electrolyte balance, acid-base balance, blood pressure regulation, and hormone production. The nephron serves as the functional unit responsible for urine formation through filtration, reabsorption, secretion. Disorders such as incontinence and retention, renal dysfunction, and kidney failure can significantly affect health. So understanding diagnostic testing, dialysis, and common treatments provides the foundation needed to recognize and manage urinary system disorders. Now in our next lesson, we're going to talk about the urinary system disorders and diseases and talk a lot more about their pathophysiology. And that is it for your urinary system overview lecture.